That's it. Good morning to you all. Just going to present the variation of conjunctival vessel width as a marker for severity of retinopathy. Diabetes is a multi-system disorder and eye has no exception, associated with the angiopathy that is both microvascular and macrovascular. The retinal vessels differ in histology from elsewhere in the body as the presence of pericytes. So the readily visible vessels in the eye are the conjunctival vessels, which can be easily visualized and documented. A few questions: that does diabetes affect the conjunctival vessels? A number of studies have shown that it shows the loss of capillaries and macrovascular dilatation, with a macrovascular dilatation in vessel engorgement and straightening. And these generally mirror the established vessel changes in the retina. The aim was just to assess the conjunctival vessel width in type 2 and correlate with the severity of retinopathy. 140 patients of type 2 and the age and sex matched normal subjects were taken. Assessment was done with the patients with type 2 and the severity of retinopathy was assessed. The inclusion criteria, of course, type 2 and rest of ocular surgeries and anti-glaucoma medications and any media opacities to prevent visualization were excluded. Study technique, generally ophthalmic and systemic examination. Then with the slit lamp evaluation, we took the images of the temporal bulbal conjunctival vessel and measured the width of the most prominent ones. Severity of diabetic retinopathy as per the ETDRS classification, we found that the mild and the moderate were the chunk of the patients amongst the study group, about 42.84% males and 34.2.8% in the females. This was the range of conjunctival width. As you can see, the patients with no diabetic retinopathy had about the average around 30 to 34 microns, while those with mild and moderate NPDR showed a chunk of this for the 41 patients, that is 29.2 and 32. And the p-value was less than 0.001. This is a bar graph showing the relationship between the severity of retinopathy and the conjunctival width. Just to conclude, the positive findings of the study was that in patients with diabetes, there is an increase in the caliber of vessels and it increases significantly with the severity of retinopathy. And also significant is a difference in the conjunctival width in eyes with mild and moderate NPDR and those with severe NPDR. Thank you, sir.
Conjunctival vessel calibers?
Sorry, sir?
How did you measure the conjunctival vessel calibers?
So the caliber was done with a slit lamp. There was a pre-programmed according to which we measured the width of the most prominent one, and accordingly we graded it depending upon the average.
There is a mechanical way you measured.
Sorry, sir?
You just saw it in slit lamp and measured with the slit lamp light width, correct?
Measured on the slit lamp, sir.
Okay.
This be used as a marker for progression?
Sorry, sir?
Can this be used as a marker for progression, to study progression?
Sir, if you are following up the patient for a long period of time, let's suppose he's with a mild NPDR or probably moderate NPDR, if you measure the conjunctival vessel width over a period of time, as seen that with the severity of retinopathy, of course, the conjunctival vessels caliber and the tortuosity and the increases. So over a period of time, you can assess the follow for the severity.
Do you think that this is anyway linked to any other comorbidity along with diabetes, or it is primarily a diabetic cause?
Sir, in this particular study, I'll say we just concentrated on the diabetic patients and excluded the other ones. But then, of course, if we are taking the temporal conjunctival vessels, there can be variations because of the other conditions like all the environmental conditions as well. So probably that could also alter the study, but in such patients we could make it out that with the diabetes, the conjunctival vessel width was showing a significant correlation.
Okay.